Hello, beautiful women and men, and welcome to Making It on Mondays. I'm actually running this on my phone today because for some reason I can't seem to connect to Facebook properly on live on my computer. So I apologize if it's a slightly different view that you're seeing this morning, and I hope you can hear me as well as you would normally be able to hear me. So welcome to Making It on Mondays. Today we're going to talk about how to prepare for an embryo transfer. My name is Louise Jeffrey. I'm an acupuncturist. I'm a practitioner of Chinese medicine. I'm a mindset coach, and I'm your regular Making It on Mondays person at the moment. So I'm just going to change this view slightly and move it over. I hope that you guys can see me. All right. So I'm going to talk for about 10 minutes today, and please feel free to ask any questions. To make any comments, if there's anything that resonates with you, please let me know if you've got any thoughts on what I'm sharing. I'd love to hear from you guys because it gets a little bit lonely, when I'm here by myself. Now I can see that someone else is on with me, but I just don't know who that is. So whoever it is, welcome. Unfortunately, on my phone, I can't actually see who is on with me. All right. So I'm just going to be checking my notes as we kind of go through today. And because I don't have my normal computer screen, it's slightly different. So if you see me kind of viewing things differently, please, I apologize and please excuse me. All right. So before we start talking about the IVF cycle, it would be remiss of me not to touch on what ideally we should have been preparing or working on in preparation for starting IVF. Or for going into an IVF cycle. So I just want to touch on what we really need to be focusing on prior to an IVF cycle. And then I'm going to move into the IVF cycle itself and how to prepare for an embryo transfer. So when we are preparing for an IVF cycle in general, you guys will have heard me speak before on how to, how to prepare. I've talked about prioritizing our health, managing our stress levels using yoga and meditation, therapy and acupuncture, making sure that we are taking our prenatal vitamins and supplements and herbs if they've been prescribed, making sure that we're eating well. So all those sorts of things prior to even starting or even getting into an IVF cycle are really, really important. But what I'm going to do today is I'm going to talk about, once we start an IVF cycle, what it is that we can actually do to prepare for that embryo transfer. All right. Now, whether it's fresh or frozen, really the preparation is the same. There's no real difference. The only difference in a fresh cycle with IVF is that obviously there's stimulation meds and there's a whole lot of other meds, other things that are going on in the body. They're probably tracking our bloods and scanning more often. So, from our perspective, we kind of treat you the same. From a physiological perspective in terms of your body, it's really just that your body it's going to have to metabolize more, right? The liver is going to have to work harder to metabolize those meds. But from our perspective, the preparation is really the same, okay? So before we start, I just wanted to share something with you. A lot of women worry about the embryo itself. They worry about, how delicate that embryo is. And before we start, I just wanted to say something, which is that, every day around the world, embryos survive in the uteruses of women, okay? Women that are working in fields, that are tending to crops, that are working at checkout counters, that are enjoying business lunches, with wine or jumping on and off of bicycles. But your embryo is obviously slightly different because you've put so much effort into getting this embryo, hi Kimberly, getting this embryo to where it is today, okay? So we always suggest that it's probably worthwhile just treating yourself a little bit more gently in the few weeks during your IVF cycle and during your IVF cycle. A lot of women also worry about whether the embryo itself, once it's put in, can actually move. And you've probably heard the analogy of the embryo being like a raspberry seed in a jam sandwich. The embryo can't fall out. It really is kind of like a jam sandwich. It is in there. So I just wanted to kind of put your mind at rest in terms of the embryo and let you know that, once that embryo is put in there, obviously you're exactly the same as as anyone else in terms of a 2-week wait. It's just that obviously you've got a lot more invested, and it's taken a lot more effort to get you, to that point. All right. So we've talked about, and briefly touched on prior to an IVF cycle, but let's talk more about the cycle and how to prepare in each of those stages. Okay, so we're going to talk about, we'll sort of break it down slightly, and we're going to focus on, not on the things you can't control, because there's certain things in an IVF cycle you can't control, like we can't really control at this point the quality of the embryo. We can't control necessarily exactly how we're going to respond to certain meds or the IVF meds, but we're going to focus really on the things that we can control. Okay, so I'm going to really focus on now what are the things that we can control within an IVF cycle that we believe can really make a positive impact, on your embryo transfer. All right, so let's start by talking about sleep. Now, sleep is really, for me, it's one of the cornerstones, it's one of the pillars of not only good health, but really of fertility. You guys would have heard me talk about sleep a lot on other lives. It's been shown that in that lack of sleep in the medium to long term, obviously not short, not in the short term when we lose sleep, that's not so much of an issue, but in the medium to long term, lack of sleep can really negatively affect our fertility. So we suggest that in at least the 4 weeks leading up to the IVF cycle, and of course during the cycle too, especially in the first couple of weeks, that you're really getting 7 to 8 hours of uninterrupted sleep per night. Okay, and if this is not possible, then sleeping as much as you can and going to bed earlier, even if you are restless, is going to be really, really helpful. And the same goes for stress. We really want you to be reducing your stress in the lead up to your IVF cycle. And then, of course, again, during the cycle itself, all right? Because what we know is that stress hormones are really not helpful for fertility. And they're not helpful for conception or for implantation. So if you have a big work deadline, for example, coming up, and it's going to coincide with your IVF cycle, it's probably best to reschedule the cycle until things are quieter, or to reschedule your work deadline if you can. Okay, sometimes it's not possible, and we can't unfortunately know exactly when our embryo transfer is going to be, or exactly when our IVF cycle is going to be. So it's it's really important that if as much as possible we try and reduce stress so that we can keep our stress hormones down, because they can obviously interfere with that IVF cycle. All right. Another thing that's really important as we prepare for embryo transfer is making sure that we're getting enough water. I don't know if you guys know this, but 70 to 80% of Australians are chronically dehydrated. That's because within our diet, we just don't have as much water as we used to have, perhaps because we're having more processed foods, but we're also drinking more coffee and tea, which dehydrates us, right? So it's really important that we make sure that we're hydrated. The body needs to be hydrated. It's really, really important. So, drinking 3 to 4 liters a day. I wouldn't say more than 4 liters a day, but, really anything from 2 to 4, but ideally 3 to 4 liters a day of water is going to be really, really helpful for preparing your body. All right, so now moving on to diet. We often get asked, do I need to stop eating sugar or drinking alcohol whilst I'm in an IVF cycle? Now, we suggest that it's really important to start making healthy choices now, and actually prior to your IVF cycle, that are going to follow you through all the way through your pregnancy and beyond. And as I've said before, we really suggest eating mainly a whole food diet with very few processed foods. And the reason that we say this is because it's important that when we eat clean and we eat whole and we eat organic, we're reducing the amount of pesticides that are going into the body, okay? And when we reduce the number of pesticides, we take a load off the body and we allow the body to do to focus on the IVF cycle, to focus on the transfer, to focus on implantation, okay? So we know from research that pesticides interfere with reproduction, with reproductive hormones. And from a TCM perspective, we also recommend that avoiding eating cold or frozen foods and cold drinks out of the fridge and avoiding too many raw foods is really important in the lead up and during an IVF cycle. And actually that is is really true as well for post-embryo transfer. But when you're preparing for an embryo transfer, staying away from cold drinks, too many raw foods, and also making sure that you focus on lots of winter soups and stews. Again, with lots of, cooked in a lot of water so that we can remain hydrated. And we really want to keep the uterus and the middle burner really, really warm in an IVF cycle. So when we're putting warm drinks, not that you have to have hot stuff all the time, but when we're putting warm drinks and soft, warm foods into the body, it's going to keep the digestive system and the uterus warm. So really important that we keep the uterus warm. And while I'm talking about keeping the uterus warm, really important not to go for any cold swims, okay, during your IVF cycle, in the lead up to your embryo transfer or after, because we really want to make sure that that the uterus stays warm and we don't want to expose it to cold. And that also means that we need to keep the uterus. We need to keep the uterus warm at all times. So don't expose it to cold. Don't be wearing midriff tops or anything like that, especially during cold wind. All right. Remember though, just coming back briefly to diet, the key word in an IVF cycle is really moderation. If you want to have a dessert or a slice of pizza, if you really feel like it, then go ahead and have it, right? I always work on the 80-20 rule. If you're eating well 80% of the time in an IVF cycle, if that's 90% of the time, your body can cope with that other 10 to 20%, right? We don't want to be too strict and controlling because that creates more stress in the body, and we don't want that either. But we just want to make sure that, that you're eating well most of the time, that you're eating well sort of 80 to 90% of the time. Having these little things here and there is not really going to make a huge difference to you during your IVF cycle and in preparation for your transfer. All right. Now, just touching briefly on coffee and alcohol. We've done a few lives on this before, and when we talk about an IVF cycle, there's no hard and fast rule here, right? But we know that studies show us that even moderate amounts of coffee and alcohol can negatively affect IVF outcomes. So we generally suggest avoiding both coffee and alcohol in the lead up to your embryo transfer, so for those 2 weeks, and then after your embryo transfer as well, right? So the same applies to the 2-week wait. And particularly during a full stim cycle where you've got stimulation meds, they put an extra strain on the liver. So the liver's going to have to work extra hard, to metabolize all the meds. So we suggest that during an IVF cycle and in the lead up to your embryo transfer that we avoid, coffee and alcohol. All right. And then obviously if we fall pregnant, then avoiding alcohol is really important too. Now with regards to exercise is almost always a good thing. Not only does it improve your overall health, but it does a lot for your mental well-being too. However, doing excessive exercise is really to be avoided, in an IVF cycle, particularly post-embryo transfer. But in the lead up to your embryo transfer, we suggest that you avoid things like CrossFit or HIIT or getting a heart rate above 135, because what we don't want is for you to become exhausted. Okay, we don't want your chi to be depleted. We want all the chi that you have to go towards, helping your body and supporting your body through the cycle, and obviously, focusing on implantation of the embryo, and then, then moving into your pregnancy as well, in maintaining your pregnancy. So really from the start of your IVF cycle, making sure that we're not over exercising. Gentle exercise like walking and running. Sorry, not running. Gentle exercise like walking, or very gentle yoga, no inversions, no twists, is really good because it keeps the chi and the blood moving. But we don't want to be doing anything too strenuous, in the lead up to your embryo transfer, and certainly not afterwards as well. All right. Then briefly with regards to beauty products, coloring of hair and manicures and pedicures during an IVF cycle. And this mainly applies really to after the embryo transfer, but as far as I'm concerned, avoiding it in the 2 weeks in the lead up to your transfer as well, so it's not still in your system when you have a transfer, is avoiding fumes and perfume skin products. Really important just after your embryo transfer, and in the few days after, because we know that embryos are very sensitive to fumes. But as I say, really avoiding anything that's too chemical, putting stuff on your skin, hair dyes, painting your nails, going into an environment that's too chemical, not painting your house. Really avoiding that and making sure that that you're not exposing yourself too much. Then one last thing really to avoid during an IVF cycle, in the lead up to your embryo transfer and after, is hot tubs, hot baths and saunas, just to be really, really careful. The heat can be really damaging to the embryo, and obviously this applies to pregnancy as well. I also think, in the lead up to your embryo transfer, just being careful if you're having, a warm bath is absolutely fine, but obviously hot saunas and things like that, we have to be really, really careful about hot tubs and saunas, again, because it heats up the body too much and can kind of dehydrate you. And then the last thing I want to mention for you during your IVF cycle in the lead up to your embryo transfer is acupuncture. So if you haven't yet included acupuncture, alongside your IVF cycle, now might be a really good time to do so. During an IVF cycle, we use particular protocols that focus on microcirculation to the ovaries, microcirculation to the endometrial lining. We also focus on regulation of hormones, and we focus on helping you to de-stress, right? And really helping you to relax and support you through your IVF cycle. Most women who have acupuncture have what the IVF nurses call that kind of acupuncture glow, because they're actually much more relaxed, because we know that IVF can be really, really stressful. So acupuncture, we do different protocols pre-transfer and then again after transfer. And obviously if you're a more of a poor responder to IVF, then we do specific, we do electroacupuncture. We might use something slightly different. And if you are in a frozen rather than a stimulated cycle, you can take herbs in the lead up, to the transfer. And you can also take, herbs post-transfer as well, different herbs. So, but obviously we don't give you herbs during during a stimulated cycle, because we don't want to interfere, with your meds and how you respond. All right, so to recap and to summarize then, because I know that I've gone slightly over time on how to prepare for an embryo transfer. Number one is to make sure that you're getting adequate sleep, especially not just in those 2 weeks prior, but probably 4 weeks prior, really making sure that you're getting your 7 to 8 hours of sleep a night. Number two is to reduce stress. Try and reduce your workload, if you can, if it's possible, and keep your stress levels down. Number three, make sure you're adequately hydrated. So you're drinking 3 to 4 liters of water a day. From a diet perspective, eating whole and organic, especially avoiding pesticides. Number five is to reduce or really eliminate coffee and alcohol, but particularly in those 4 weeks of your cycle. Number six is to exercise very gently, but also get plenty of rest at the same time. Number seven is to avoid fumes and chemicals as much as possible, both before and after your embryo transfer. And number eight is to use acupuncture and herbs to help support and prepare your body for the embryo transfer. So I think that's it for now. I can see that there's a few people on with me, which is great. Kimberly and Sigrid. Hi, Sigrid. And Anna. And if I usually swim regularly, should I stop? And for how long? Anna, yes, the answer to that is that I would stop swimming, as you start your IVF cycle. I don't know if you're swimming in cold water or if you're swimming in a heated pool, but if you're swimming regularly, in those first couple of weeks, when you start your IVF cycle, I would stop swimming, but particularly after your embryo transfer, make sure you don't swim. And I think wait until your 12-week mark before you start swimming again, because we really don't want a cold uterus. It's really, really important, that we maintain the blood flow and that we keep the uterus, warm and flowing nicely. So, and I hope that answers your question. And then, you said for how long, and that's really, through until week 12. And again, even during your pregnancy, I wouldn't be swimming in very cold water. I would probably just be keeping it to, in the summertime, kind of whatever whatever the pool of the sea is in summertime, but obviously in winter we have to be very, very careful of cold water. So I hope that is helpful. All right, that's beautiful to see you guys on with me. I think that's it for this week. I'll be back next week at the same time. If there's anything that you guys would like to talk more about, if you'd like, any topics. Hi, Philip. If you would like any, any topics that you'd like me to talk about, things that you want to know more about, things that you have questions about, whether it's IVF or natural conception or anything, let us know and we can, talk about that in the upcoming weeks. So that's it from me. Bye for now. I will speak to you guys all soon. Bye.